NBC's Antonia Hilton is in Newark, New Jersey, where she talked to a group of black nurses about the nerves around the vaccine. Antonia, good to see you. There is, of course, a good reason for the distrust that many in communities of color have of the medical system. How are these nurses that you talk to handling it, and what's their message to their community?
Hey, Casey, nice to see you too. It's been really interesting. So I'm at University Hospital, and this is the site where the very first person in the state of New Jersey is going to get vaccinated tomorrow. But they also surveyed their staff and found that only 50% of them feel ready to take this vaccine. And of the 50% who aren't, the majority are people of color. And so as I spoke to these 6 black nurses, some of whom work right here, it was really fascinating to see the factors that have come together on this. You know, the first is this is an extremely segregated community with a long history of discrimination. Many people have lost loved ones and are grieving and are angry, so they have much less trust in the institutions that they believe were supposed to serve them. There's also a long history of medical abuse of black patients throughout this country, and that's very present on the minds of residents that I've spoken to and the healthcare staff. And then finally, there's a political element here, too. Both the nurses that I spoke to and residents say, you know, black people in Newark, they're not the biggest fans of President Trump. They feel like he's been associated with this. They feel they've seen him rush it, try to politicize the vaccine, and they feel his association with it makes it sound more risky, frankly. So take a listen to this conversation I had with the nurses here.
Show of hands if you're 100% sure you're going to end up taking this vaccine.
Eventually.
Approved. It was approved.
Yeah.
Why is there that lack of trust?
Our history, be it from Semmelweis with the experiments on black women, be it Henrietta Lacks, be it regardless of who it is. When you don't see people of color, you don't know who to trust. And even sometimes myself, when I go into a institution, and I don't say that I'm a nurse, the treatment is different.
So I was pretty surprised to see right there in front of my face that only about half of them raised their hands, but that trust piece is going to be key. So I spoke to the CEO of this hospital, Dr. Sharif El-Nahal, and he told me that he expects that trust issue to be the major bottleneck as they try to get people here vaccinated, both staff and the residents that they serve. They're trying to fix this by sending black healthcare workers and faith leaders into the community to talk to people face to face about it. But they're really going to have to take their time and listen, and it's going to take some months' time. You cannot take decades and hundreds of years, frankly, of hurt and solve that with just a couple weeks of conversation.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Beat the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.